pelvic pain can be so frustrating. You just had a baby, there's so much going on with your body, and then you are experiencing discomfort in your pelvic region or in your lower abdominal region, and it is just not comfortable. So we're gonna go through 5 different tips that you can start to do today that are gonna help heal your pelvic pain, especially if you just had a baby or if you've had a baby in the last 5 years. Tune into the entirety of this video so you can truly grasp all of these concepts, tips, and stretches that I'm gonna give you to heal your body holistically from this annoying pain. When we have pelvic pain, it can impact our relationships. It can be very frustrating. Our libido might already be low or out the door because of the fact that we're not sleeping. A lot of times right after the pregnancy, we have a very low dip in estrogen, especially if you're lactating. And that can take 6 to 12 months to really beef back up and help improve your libido. So if you have pain on top of that, it can highly affect your relationship, and it's just not fun. So I want you to do these tips and truly embrace them and embrace these practices so you can start reinvesting in your relationships and in yourself and feel like yourself again postpartum. All right, here we go. You're gonna join me first for this inner thigh stretch. This is gonna help open up the fascia and the muscles that attach to the inside of the pelvis. So join me with this stretch. You can do this on your countertop, or you could just do it in a doorway. I just want your body to feel supported so you can relax into these positions. Here we go. So if this is countertop height, what you're gonna do is you're gonna rest your elbows and stick your butt to the back wall, separating your feet a little bit more than shoulder width apart. And then you're gonna drop your hip. So if I'm gonna take my right hip to the opposite back wall, stretching the inner left thigh, and you're gonna hold this for about 30 to 60 seconds. You should feel the stretch all the way up to the pubic bone itself, and this should not be painful on your SI joint or down on your knee. You're gonna then switch sides. When you switch sides, this is what it will look like. You'll drop your left glute to the opposite back wall here, stretching everything up on this inner thigh and growing. And again, once I release that after 30 to 60 seconds, I can switch sides. And this is what it looks like from the back. It's a little bit easier to see that hip drop to the outside back wall. If you have to, you can bend this knee. That brings the stretch a little bit lower into the inner thigh. This inner thigh stretch is going to be essential for helping open up the pelvic floor, but also open up the inner thighs. Now, I didn't mention this in the beginning of the video, but it is very common to have pelvic pain or pelvic discomfort, achiness, just feeling after you have a baby. So these stretches are going to be super important to help bringing the blood flow and the flexibility back to the muscles so they can start to feel better and heal. Everything that attaches to the pelvis tends to get tight after childbirth, and that can be a major reason why we end up with pelvic pain or pelvic discomfort. So doing that inner thigh stretch is amazing if you had a vaginal birth or if you have a C-section. We're going to dive into the next stretch now. Here, we're gonna go into a hamstring stretch. So we're stretching the back sides of our legs and everything that attaches to the back of the pelvis beneath the glute, okay? So we want to help release the tension here, helping open up the pelvis, relax the pelvic muscles. And so here, we're gonna go into this stretch. Your arms are supported by the table. Your feet are about shoulder width apart. You're reaching your tailbone to the back wall, and you're holding that for 30 to 60 seconds. This should feel really good in your calves and in your hamstrings. You want to keep your toes facing forward to get the calf muscles as well. A lot of times our posture in pregnancy is to toe out, so we want to stretch and make sure we can get our toes all the way forward. This is a great way to start releasing the tension of the lower part of the body and helping reduce that pelvic pain. These will be really important stretches for you to incorporate daily, at least once a day, to again start getting blood flow to these muscles and help loosening up the flexibility, creating flexibility in everything that attaches to the pelvis. A lot of times with pelvic pain, we're experiencing the pelvic pain because of all the tension that occurs after childbirth. You might feel like, well, I'm so weak, I'm just, everything is just open and loosey-goosey. Actually, with scar tissue, from whether the baby comes from the belly or comes from the pelvic floor, we end up with a lot of tightness. And you can check that out in our incontinence video for postpartum. It's about incontinence, but I really dive into the anatomy of what happens and the physiology and the changes that happen for what we see clinically and why it's so important to help open up these muscles. And that will help with the pelvic pain after you've had a baby. So far we have gone through one, the adductor stretch, that inner thigh stretch, and then we hit the back of the hamstrings to stretch out the back of the hamstrings and stretch out that part of the pelvis. Now we're going to dive into the glute and getting these attachments here. Okay, this can be done in a sitting position, and what you're going to do here is you're going to take your leg up, cross the foot, sit up really tall. Imagine like you're getting pulled up to the ceiling, and we're doing a glute piriformis stretch, glute med stretch. You'll kind of feel the stretch all around that hip joint. You're going to sit up so tall, then you can hinge forward at the hip itself. I don't go very far, my hips are really tight. And so here we are just holding this position, keeping the spine really straight. Again, this side view, keeping the spine super straight, you're hinging at the hip. I'll show you what that looks like on this other hip. Again, staying nice and tall, leaning forward, you're not slouching into it. You gotta make sure you stay nice and tall. And we're holding this for 30 to 60 seconds. Try to go to a minute or two even. The more you can, the more blood flow can get to these muscles, the more length can be created through the glutes. And this is, again, going to help that pelvic pain and help you heal holistically from your pelvic pain without having to, take medication or do other surgeries. We want to try and do this as naturally as possible. So that's the third stretch I'm going to have you do today. Okay, next we're going to do relaxation for the lower abdominals and the pelvic floor. We're going to do a diaphragmatic breath to help relax the abdominals and relax the pelvic floor. A lot of times when we're having this pelvic pain, we brace, we pull the belly in, we squeeze our glutes, we squeeze our pelvic floor, and we want to help bring air in range of motion to help heal and decrease the pain sensation to these areas. So you're going to keep your hands on your belly, take a nice deep breath into belly, and exhale and let it go. Feel the pelvic floor open as you bring the air into the belly, inhaling into belly. Pelvic floor is opening. Exhale, you'll feel the recoil. And again, I'm not breathing up high here. For pelvic pain, you want to breathe low and help open everything inside the pelvis. Even if it's coming from the pain is coming from your tailbone, or if it's coming from scar tissue, or just general tension. We want to help bring the range of motion of the pelvic floor and keep the belly and bring the range of motion also to the belly and the abdominals so the fascia isn't so tight, increasing that pain. So again, you're doing this nice deep breath and let it go. This should feel good, it should feel relaxing, but it might be hard initially to get the air to go into your belly. So this is a great thing to practice at least 5 minutes a day. And this is going to help you on your pelvic pain healing journey. Okay, part of when we have pelvic pain is our bellies get hard and we hold and brace in order to help reduce the pain, but that can actually create more pain, especially if we just had a baby. A lot of times our organs are pushed out to the side because the uterus grows so big during pregnancy, shoving the colon out to the side, and then we just get kind of stuck there. And so in order to help regain normal visceral motility, so how your colon moves in its position, we also have to regain the fascial movement. And what happens after pregnancy is we become so rigid and tight through the belly. So the breathing will help get that rigidity gone and decrease the pelvic pain. But we're going to use my friendly little Corgeous ball. It has a little paint stain from the wall. But this Corgeous ball is amazing to help bring that normal motility to the organs and also help break up some of the fascial tension, which can really increase the pelvic pain. So we want to decrease the pelvic pain pain by decreasing the fascial tightness. So get one of these balls. I'll drop the link in the comments section or in the description so you can get one yourself, because these are absolutely amazing. They're great for constipation, but so good for pelvic pain management. So here, join me. We're gonna get on this ball. On our stomachs. First, we're gonna start on the right side of our bodies. We're gonna stick the ball here. When the ball is there, you're gonna prop out the left knee and you're just gonna hang out there. You can hang out there for 1 to 2 minutes. Then as you release and let your body fully melt over this ball, you can move the ball up. So we're starting with the ball down here, like kind of right in that hip crease, and then you're gonna move it up into like probably 2 different places on this side. Then you can go higher, like one right by that diaphragm, kind of underneath the ribs. Then you're gonna move it to the left, and same thing, kind of the diaphragm, some of those abdominal muscles over here. Then you're gonna go down into this hip. And you can go, everyone's torso is a different length, so it might take you 1 or 2 placements on one side, or 3 placements if you have a really long torso. And you're just melting over the ball. I'm going to show you what this looks like on the left side of my body. So when I put this on the left side of my body and on the left side of my hip, then I prop out my right knee, and then I just melt. I try to let my full body relax here and totally let go. A little bonus tip here, if you go skin to skin on the ball, you can do a little twisting and get a little bit more fascial release from the ball itself. Okay, thank you so much for joining me, and I hope these tips impact your pelvic pain greatly, helping reduce your pain so you can just heal yourself in the comfort of your own home. And just to recap, we went over an inner thigh stretch. We went over the hamstring stretch. We went over a glute stretch. Then we went over breathing to help bring that softness and flexibility to the pelvic floor and to the lower abdominals. Then we went over the Corgeous ball release to the abdominals that help bring back the blood flow and normal visceral motility, decreasing your pelvic pain. I hope you found these tips valuable. Drop in the chart how they helped you, in the comments how they've helped you. And if you have questions, please let me know, and I will drop my comments back to you, helping you conquer this healing journey in the privacy of your own home. All right, I'm Dr. Allison Felt. Until next time, I wish you the best pelvic floor journey and healing possible so you can live an active and healthy life and not be bogged down by any pelvic floor issues, including pelvic pain. Thank you so much.